This lesson will focus on the central corneal thickness, one of the 4 new measurements of the LENSTAR optical biometer. The incomparable combination of CCT and the other 8 measurements taken in less than 30 seconds will increase patient flow by eliminating a separate pachymetry measurement for every pre-op cataract patient. The central corneal thickness, or CCT measurement, is a fundamental addition to the premium IOL pre-screening data. LENSTAR CCT is measured with the precision of optical biometry and OLCR. Several ophthalmologists agree that central corneal thickness provides important preoperative screening information on conditions such as Fuchs dystrophy and Gutata. It is also important when planning for LASIK touch-up or limbal relaxing incisions. All biometers previous to LENSTAR lack this essential measurement.
One of the other important measurements for me is also the corneal thickness, which you're getting, the pachymetry. And this tells me, it can clue me in first if something's wrong with the eye. Have I missed some Gutata? Is the cornea thicker than normal? Does the patient have some Fuchs that I've not seen? Is the cornea thinner than I expect? Have they had too much prior refractive surgery? Sonia says we have patients who come in who've had more than 10 diopters of prior LASIK. And you look at their corneal thickness and it's 300 microns complete. And you know, these eyes, certainly there's no further room for doing a future laser vision correction. And finally, eyes that have a very thick central corneal measurement, if I'll perform a limbal relaxing incision or some other incisional astigmatic technique, I'll probably have to do a different depth or an increased depth or increased arc length in order to have the same effect.
Another valuable improvement only with LENSTAR is that all measurements, including central corneal thickness, can be reviewed and checked and easily modified to ensure quality. This is a huge feature and can give you confidence and comfort when you go to the operating room that your biometry was as good as it gets. Here's what an expert, Dr. Uday Devgan, has to say about LENSTAR and how he uses the CCT measurement for optimum results.
In certain eyes with a Fuchs dystrophy, too much pigment on the endothelium, so you know what, this patient may have some problems with cornea. You'll see a thickened cornea, 650 microns. That alerts you. A post-LASIK eye. Patients had a lot of post-LASIK treatment and you measure their corneas, it's only 300 microns. That also alerts you like, well, I'm going to be very careful here. I'm certainly not going to be able to go back and enhance this LASIK. So I think getting that central corneal thickness does give me some benefit. Also, even for a virgin eye, if I'm going to do a limbal relaxing incision, if their central corneal thickness is very thin, then I expect their peripheral cornea to be thinner than average too. If their central cornea is very thick, in a virgin normal eye, well, I'll be doing a limbal relaxing incision. If their central corneal thickness is very thick, I'd expect their peripheral to be also thick. And therefore my LRI wouldn't have the same effect. I'd have to do a slightly deeper cut or longer cut or more central cut to get that same effect. So I think, you know, people always say, well, the LRIs are so variable in the response. Well, what's variable is patients' corneas. And this is one way of having at least some idea before you go in the eye.
LENSTAR provides unrivaled technology that offers more accuracy in a much more convenient way. CCT no longer has to be measured separately because it is instantly and accurately measured with the other 8 LENSTAR measurements. It's a new but critically important measurement, never captured before with optical biometry. It's measured instantly, painlessly, and accurately, giving you full control of the data electronically. If you want no compromises, perfect outcomes with premium IOLs, LENSTAR will give you the edge. Call 888-MY-LENSTAR or visit mylenstar.com to learn more or to arrange a demonstration of LENSTAR so you can see for yourself how LENSTAR can provide immediate value in your practice.